Welcome back, everyone. Dr. Jeremy Heffner is with us today. He's a surgeon with Midwest Surgical Specialists through Lima Memorial. We're talking a little bit about an innovative new procedure for GERD that's it's exclusively at Lima Memorial. First of all, remind us again what GERD is and how that affects us.
So GERD just stands for gastric reflux. So a lot of people, as you know, they wake up in the morning, they feel metallic taste in their mouth, they get the burning sensation in their chest. Certain foods like spicy foods, fatty foods can really bother them. And in that group, over time, we worry about the fact that their esophagus can actually start to change and become a pre-cancerous condition, and that's called Barrett's esophagus. And so we want to currently put them on a medication long-term or do a type of surgical procedure historically that we've done. But now there's a new surgical procedure that can help prevent this Barrett's from forming and give them a surgical treatment to gastric reflux instead of having to take the medication every day for the rest of their life.
Okay, and that's called the LINX Reflux Management System. Explain what that is and how that works.
So it's actually a pretty simple device. It's a series of magnets in a circle, and when you eat the food, it goes around the esophagus right above the stomach, and when you eat, it opens up, and then it closes back down afterward, just like a sphincter mechanism would, to prevent things from refluxing or going back up the esophagus after you eat. So as simple as it is, like anything else in medicine, it's still complicated to put in, and you still require surgery to get it there.
Yeah, I'm always interested in obviously that new technology. It's something you guys have to learn about too. Walk us through that process, because obviously you have to learn how to do this and you have to get the latest on how this works.
Correct. I mean, this is a device that's been around for about 10 years now, and I waited till we had some 10-year data before we decided to use it here in Lima Memorial. Once we found that it was a safe device, and by that point, Johnson & Johnson actually bought it. And there's a process of training you have to go through where you do a certain number of procedures with surgeons watching you. You have to go through extensive educational training about the product, about all the research behind it, understand how it works, how to treat patients after you put the device in. And we have to create a whole system to make sure that we're managing the GERD prior to properly, that we're testing everything properly, make sure you're going to be a good candidate for it. And then afterward, of course, how to treat patients and make sure that they have a good outcome after we place the device. So it's taken months for us to go through that process. And now we've been up and running for approximately 4 or 5 months. We've put multiple of these in. We're doing sometimes 2-3 a week. And with that, we're pretty confident, and we've seen great results so far.
Yeah, what are some of the benefits for this new procedure over, as you mentioned, medical options before? There were some other surgical options. What are some of the benefits you're seeing?
We know with the surgical options, and there's 2 to 3 common methods that have been done surgically throughout time, is that normally we take the stomach and we wrap it around the esophagus itself. Over time, though, by about 5 years, 40% of those patients are going to require medication again. So it's not a long-term durable solution, like I said, for upwards of 40% of the population. The medications, you have to take those every day for the rest of your life. And we are seeing there's a potential now for long-term use of a PPI, or the acid medications may actually lead to some early dementia. Still in flux, but that data is starting to come out. This would be, because it's a magnet, it's a metallic device, once it's scarred in and done its job in place, it works the same 6 months from now to open and close the same as it will 6 years from now, as it will for 60 years from now. So it's a very durable operation, and we believe that, based on the 10-year data, it seems to be just as effective at 10 years as it was at 5 years. So.
Walk us through, if someone comes in and they get this procedure, what they might expect.
Well, we're going to want to do some tests on them. We have to confirm that they have GERD. So there's a device that we have to put into their esophagus using a scope. So people have had cameras or scopes placed in their esophagus. We take a look and see if they have any anatomic reasons that we can't place this. We then put a little device in there, then that measures the pH, or the amount of acid going up the esophagus, to confirm that they actually have GERD. And then we also do another test to look and see if the esophagus actually squeezes the way it's supposed to. And we do that because once I fix everything, you're going to go back to a relatively normal esophagus. And if yours wasn't working properly and you have an acid reflux, there may be a chance that when I make everything normal again, your body can't handle it. So we got to confirm that your body will be able to handle being normal again.
Yeah, it's fascinating. And as we said, exclusive with you guys. Thank you, Dr. Heffner, for telling us about it. We really appreciate it.
Oh, I appreciate it. Thank you. Have a good day.
You bet. You too. Nice talking with you. We'll be back right after this.